Median nerve flossing, again, is a neuromobilization technique that can be utilized to reduce pain or numbness, tingling along the distribution of the median nerve. So distribution of the median nerve is going to run originally from the brachial plexus. We go down through our bicep, through the midpoint of our forearm, and then it's going to supply these three fingers here largely, and a little bit of sensation here onto the ring finger. So this is the nerve that's classically implicated with carpal tunnel. Now, most people won't ever need to resort to some sort of surgical intervention when it comes to carpal tunnel, and a big reason that can help people avoid surgery has to do with conservative therapies such as chiropractic, myofascial release, and neuromobilization. So one reason why you should explore those options before going under the knife if in fact your symptoms don't necessitate the need for surgery. That aside, how we're going to floss the median nerve, there's a couple that we can start with. First, we can start with a basically what's known as kind of a prayer position here, hands together. We want to get our elbows up to about wrist level, and then we're simply going to glide from shoulder to shoulder. And as you do this, you'll probably likely feel a little bit of a stretching or pulling sensation through the forearm in that distribution of the median nerve. You might even feel some up into the wrist and hand depending on the degree of tension that you're experiencing. Another great home mobilization would be if you start with your palm facing you and then you extend your hand outward, keeping the hand extended, and then rotate it back. So palm facing, palm away, and then bringing back in, extension of the arm, extension of the wrist. Again, depending upon somebody's severity of symptoms and the degree of range of motion that they can achieve, we may have to start with some easier progressions and then advance. There's also the option of utilizing a wall. You can get your hand flat against the wall. Once your hand's flat against the wall, we'll want to rotate the palm and the fingers away from us. Okay, so if my ring finger, middle finger, basically pointing up to 12 o'clock here on the wall, if I turn them back to about 9 o'clock and then put my palm flat on the wall about shoulder height, I can rotate away a little bit and back in. This again is going to be a pretty intense mobilization for the entire median nerve. I can even incorporate some head tilt to the side here. So if my left arm is on the wall, I can tilt my head to the right, and this will get a little bit more of a mobilization completely through and including the brachial plexus.